All right. Hello, everyone. My name is Courtney Edgcomb, and I'm the president for the United Way of Volusia-Flagler counties. And we also have Amanda Lasecki with us today, our vice president of operations. And we would like to welcome you to the A.L.I.C.E. in Focus Children webinar to learn more about the A.L.I.C.E. report that was recently released in April of 2022, focused on families in our community. For many of you, you might remember the A.L.I.C.E. acronym. It stands for Asset Limited, Income Constrained, but Employed. And basically what it means is our community is working poor. It's no surprise to us that there are families in our community who are struggling to make ends meet every single day and who are living paycheck to paycheck in our community. So in 2017, the United Ways of Florida commissioned a report in partnership with Rutgers University to do a study into those families who are making more than the federal poverty guidelines, but less than what it takes to actually survive in our community. We have had over 3 reports to study the Volusia and Flagler households. So that could be individuals, it could be families, multifamily units living in a home. And what we found in our most recent report, which was released in February of 2020, is that 45% of Volusia and Flagler households were struggling to make ends meet. That means that 1 out of every 2 families is living paycheck to paycheck and with the stress of how to pay their bills and how to take care of their families. Obviously, this is something that we want to work on and something that is a major struggle in our community. We've been on lots of talking tours to let people know and raise awareness about the issues that the A.L.I.C.E. population is facing, and also what it takes in order to survive in our community. So most recently, the United Ways of Florida went to Rutgers University and asked them to help us with identifying key target populations of people in our community who are struggling. So the first report is about families. In April of 2022, the A.L.I.C.E. in Focus Families or Children report came out. And what we found is that in the state of Florida, over 2.3 million children are living below the A.L.I.C.E. threshold. 17% of them are living in poverty, while 39% are living in families that make between the federal poverty guidelines and what it actually takes to live sustainably in our community. So again, over 2.3 million children in the state of Florida are living in homes where it is a constant struggle to figure out how to pay their bills, and they're living with the stress of those financial issues. What we have found in Volusia and Flagler counties is that over 60% of families are at the A.L.I.C.E. threshold or below. This is something that we really want to focus on, and an area where we want to consider why is it that families are more adversely affected, and what are the things that they're dealing with. And the biggest question is, are there any solutions for us to provide to these 92,000 families in Volusia and Flagler counties? A little bit about the resource that we use. Rutgers University has created us a website called unitedforalice.org. This report is very different from our prior reports for A.L.I.C.E. because in prior reports, they're taking the information from the American Community Survey. And every report is about 2 years behind due to access to data. But prior household reports have given us groupings of Volusia and Flagler counties. However, for this one, for the focus on families, we're actually looking at 5 regions as we look at the data that's specific to our community. So the first region that we have is the light blue one where it says Palm Coast. And this one is our Flagler County area. Then we have Northwest Volusia County, which would be Pearson, DeLand, De Leon Springs. We have Northeast Volusia County, where it says Daytona Beach, and that would be Daytona Beach, Ormond Beach, and Holly Hill. We have the Southwest Volusia County area, and that would be Deltona, Lake Helen, and Osteen areas. And then finally, our Southeast Volusia County, which is comprised of New Smyrna Beach, Port Orange, and Edgewater, among other cities, but those are the larger ones that we're looking at. So one, as we're looking at this data that's been broken out for us, we're looking at it in smaller subsets, and it is broken up by population of about 100,000. So it does give us a chance to look at the data a little bit more in depth and maybe identify some areas where we have more targeted issues. The other thing about this resource is that they use a great tool called Tableau in order to put it all together. You can look at multiple states worth of data. You can look at multiple regions worth of data in order to compare and contrast, figure out where we rank among others, and also if there's other areas where there might be issues. Then there are categories and subcategories. So some of the data can be broken down by age, and then specifically by infants or toddlers, elementary age, anybody under the age of 17. We can look at education, attainment. We can look at race, and lots of other information that you'll hear about today as how we have reviewed the data, broken it down, and synthesized it for this report for you today. So there are lots of changes to the way that the report is presented, but I think that if you are somebody who is a data nerd and really enjoys getting into the information, this is a wonderful website for you to explore and to look and see what information is available for your organization or for your own knowledge. So with that, I'm actually going to hand it over to Amanda to tell us a little bit more about the data.
Thank you, Courtney. And I did want to share with everyone, so we talked about those categories. So I'll just run through those real quickly. There's 11 categories that you can sort this data by. So we have age, race, ethnicity, nativity, language, disability, household working status, housing, education, health insurance, home internet, and public assistance. So you're able to really do a deep dive into all that different data. So we're going to highlight some of the data sets today, and then I'll turn it back over to Courtney to close with some possible solutions. So our first slide, we're talking about disproportionate impact. So you can see our different PUMAs, those areas that Courtney referenced of 100,000 or so population throughout Volusia and Flagler County. And in this particular circumstance, you can see it broken by white, Hispanic, and Black. And you can see the percentage of ALICE families by race is pretty significant, particularly in Southeast Volusia, where over 90% of those residents who are Black are ALICE families. So you can look at it by area, and the numbers start to really tell a story of who is ALICE within each of those areas. So the next area that may not be a surprise to anyone that has children is that families with infants are significantly more likely to be ALICE families. And we know that childcare costs keep rising. Where it used to be $150 a week, it might be $200 a week. I know some people upwards of $250 a week for infant child care, and also the challenges at this point that we know how difficult it is to find. So the waiting lists are long to find a child care facility that will accept infants. And even if you get into one, the cost of paying for the child care, and you also have to provide the diapers, the formula, everything else that goes with that, can be really challenging for our ALICE families. And a lot of times we see that those families make a decision about if a parent should leave the workforce. A lot of times that burden might fall on the mother to leave the workforce and provide the child care, and therefore not being able to provide income into the household. So families with infants significantly more likely to be ALICE, and that kind of leads into our next slide, where we look more at the families who are both working. So both adults in the household are working jobs, but still struggling. That's kind of our headline here. And sometimes that's a myth that we hear, or something that's maybe misunderstood in the community is, well, if both parents in the household were working, then they would be able to make ends meet. And what we find with this data is that's definitely not the case. You can see specifically Southeast Volusia, where over 50% of the households where both parents are working are still ALICE families. They're still one car breakdown away from disaster. And we find that compared with a one adult, one worker family, of course, these numbers are going to be significantly higher. But compared to what you see on the screen, Flagler has 93% of one adult, one worker households are ALICE families. And of course, here in Volusia and in Flagler counties, our workforce has a lot of retail industry, service sector, hospitality, seasonal types of low-paying jobs. So with those low-paying jobs, you may have more than one person working, but you're still not able to pay all of the bills. So one area that this particular data set covers is disabilities. We will have more information with coming ALICE looking deeper into specific disabilities, but we wanted to highlight this data that over 50% of families with a household member with a disability are ALICE. And specifically in Northeast Volusia, you can see that number is very striking, that 92% of all the families with a household member with a disability are going to be in that ALICE threshold. And so that's an area where we can take a deeper look and say, is that due to a lack of resources in that area? What is it specifically in that Northeast Volusia area that's causing those with a household member with a disability to fall into that ALICE threshold? So stay tuned for more information. Later this summer, we'll hold a forum specifically to talk more about disabilities and invite some of our community partners in that arena to talk more about that. So what is the effect that this has on these families? So one of the big takeaways that we found was rent burdened. So our families are definitely rent burdened. You can see in Florida, 61% are. And what that means is they're spending over 35% of their income on their rent. And as compared with Volusia and Flagler County, the startling number that strikes us is 96 to 100% of all the families in Flagler and Volusia are rent burdened. So the numbers keep rising. I know here at United Way, a lot of our phone calls into 211 for help are for rental assistance, eviction challenges. People are not making enough money to afford the rising inflation of their rent. And when you zoom out at this rent burden map at the whole state of Florida, you'll find it's a lighter blue. We are a very dark blue significantly, and affordable housing is definitely a conversation we're having across our communities, but it continues to be a challenge. It continues to get worse. And that's an area where we really need to focus on for our community. Access to services looks at two different areas. So we're looking at SNAP. And for those who may not be familiar, SNAP is what was formerly known to some as food stamps. So over half of all families not participating in SNAP are ALICE. So we know that these families are eligible to receive SNAP assistance, but for some reason, they are not accessing those services. And same thing right below, over 40% of all families not receiving medical assistance, that could be Florida Kid Care, Medicaid, those are also ALICE families. And so it leads us to wonder, what could we do to ensure that these families, one, are aware that they're eligible? They may not even realize that they're aware or that they're eligible for these services. And then two, if there's any type of stigma possibly associated, maybe there's a reason that they're choosing not to take advantage of these services. And we definitely could help our nonprofit agencies as they're doing, intake paperwork, case management, just making sure that all the families are aware of the services and eliminate any barriers to receiving them as well. And then our last data point to focus on today is access to home internet. So in Southeast and Northwest Volusia, it's very restricted for these ALICE families. And 90% of those without home internet are ALICE. And we found this particularly impactful during COVID, when the whole world shut down and the kids were sent home to do their homework at home. These families did not have reliable home internet. And so that's created is a gap in education for these children that they're not able to do their homework from home. And I know as a parent with two kids in Volusia County schools, now they have a laptop where they have to download the app and upload their documents, and not having that home internet is really putting those kids at a disadvantage. And then one thing I'll add, besides the impact, of course, on the children, is that families, parents, when they're trying to do their job search and apply for jobs from home, don't have that home internet access. So that's a real opportunity that we could look into, that we could invest in, that would really raise the quality of life for those families. So with that, I will turn it over to Courtney to talk a little bit about some potential solutions to these challenges.
Awesome. Thank you, Amanda. I really appreciate that Amanda was willing to share the data from the report, because it's not the most exciting information. I mean, it's very enlightening for us, but it is bleak when you start to look at what these families are dealing with. And especially as we break it down into specific areas, we're having a better view of what the challenges are. And at the same time, it can be very disappointing. It can be hard to listen to, but I'm glad that Amanda let me do the part that talks about the things that we can do to help support these families and maybe a brighter future for our community as a whole. So the first thing that I want to say about any solutions that we might propose is that there's not going to be a one size fits all. There's not a magic pill that's going to fix this problem. There's nothing that you can't just focus on affordable housing, and then because we make things more affordable, everybody's doing fine again. It is really going to take comprehensive and interconnected solutions in order to support these families and to address these problems. So just know that as we are talking about some of these different areas, it really is going to take an entire system in order to make changes to support these families. And there's not just one person or one group who can do it. One of the things that I like to talk about is that there are currently supports for A.L.I.C.E. families. So for instance, an A.L.I.C.E. family in our community, if they are making less than $26,000 a year, they're considered under the federal poverty guideline. So it's a family of four, and our community needs to be making less than $26,000 a year. However, for a family of four in our community to be at the A.L.I.C.E. threshold, they have to be making less than $70,000 a year. That is a very dramatic difference. When you're making $26,000 or less than $26,000 a year, you're qualifying for quite a few resources. And what happens is that families are qualifying for those resources. They get access to subsidized childcare or maybe additional tax credits and other things that are helping them live. But as soon as they take a 25-cent an hour raise or they get a promotion at their job, they fall off the fiscal cliff. They go from receiving resources to nothing. And so a lot of times, anecdotally, we have heard from our agencies that they have had clients who have had to say, no, thank you, to a raise, because if they were to take that raise, they would lose $2,000 a month in childcare support, or they would lose their SNAP benefits. We don't want that for families. So one of the things that we advocate for is a graduated system where the more that you make, the less that you receive in services, but it is almost like a trade-off in order to help families move into sustainability. And like I said, there are quite a few resources that are already available assisting those A.L.I.C.E. families. If you are a friend or a family member of an A.L.I.C.E. person, one of the things that you can do is provide temporary housing. I know that's not a long-term solution, but it might just be the stopgap to get them through to the next thing. If you are gifted at welding, or if you know Excel really well, tool and trade sharing can be very important for these A.L.I.C.E. families, because it might open up opportunities to better employers with better benefits and better pay. And then another thing is, if you work for a company that offers you paid time off, paid sick time, maybe there's some flexible work schedule, things like that. let those families and those individuals know when job openings are happening. You also might know of other community organizations that have similar types of benefits like healthcare and retirement plans. Letting A.L.I.C.E families know about when those good employers are hiring can be very beneficial for them and give them a leg up. Another thing is nonprofits are doing their part. We are funding programs that are working on temporary to permanent housing. Our tax preparation or VITA services, it stands for Volunteer Income Tax Assistance, is free tax preparation for people in the community. They can go to any of our sites during tax time and they get their full refund back. So that is a really great resource that's available. We partner with many organizations that work on subsidized childcare to assist these families. Things like caregiver respite, which we'll dive into more once we have that disabilities focused report. And then other things like affordable housing, which we talked about as a major issue, but nonprofits are supporting in all of these areas in order to help A.L.I.C.E families survive. The government is also doing their part. So things like housing subsidies, tax credits, education vouchers as well, and the ways that we connect with private and public partnerships for attracting higher skilled jobs are all ways that we're attempting to support A.L.I.C.E families through the government's leadership. And then finally, as an employer, if you happen to be in a position of influence at your organization where you could advocate for paid days off, full-time opportunities for people, or flex time for individuals who might be dealing with family emergencies or summer camp, all kinds of things that are happening. Mentoring is another avenue where somebody could offer some trade, some tool sharing, and offer some mentorship that might help move an A.L.I.C.E family into sufficiency because they're getting the additional support that they need. Employers have lots of opportunities to make their organizations not only more competitive and enticing to the job market, but also more friendly to A.L.I.C.E families. We feel that it is our duty to share this information. We really feel like this is a great opportunity for us to get the word out about A.L.I.C.E families because we want to advocate on their behalf. But we also know that you can use this data in a lot of different ways. So when we're talking to a lot of our nonprofits, we're finding that our agencies and other community organizations love to use this data for grants. You can go on to the unitedforalice.org website, take a look at all of that data, sort it out by those 11 categories like Amanda was talking about, and figure out what information would be most useful for you as you're attempting to state a case when it comes to grants. We also want you to be able to use this information to better understand your clients. If they're coming in and they're asking about housing, chances are that's not the only issue that they're dealing with. And maybe there's other ways that you can help connect them to resources that might better help them. And also to keep the conversation going. We don't want our community to forget about these A.L.I.C.E families or the struggles that they're dealing with as we're dealing with rapid inflation. If anything, we want to draw the spotlight even more and draw more attention to what these families are doing. And finally, we would encourage you to take this data to all of your elected officials and use it to encourage them in their policy and decision-making processes. Your United Way is using this data in very similar capacities. We're using it to better understand our community and to paint a picture of what the need is locally. We want to also use it to better inform our funding process. So now that we can break the data down by these groups of about 100,000 residents, and Amanda pointed out quite a few of the areas where we're seeing there's a disparity here. This is very different in Southeast Volusia, or this is very different in Northwest Volusia or Flagler than it is anywhere else in our region. So why is that? And are there specific resources or initiatives that we could put in place in order to address those challenges? So that's one thing that not only are we looking at as a leadership team, but we're also looking at with our community impact cabinet as they are entering into their next phase of funding. We're also looking at how we can use this data for grants and corporate support. And finally, to alert donors of community needs and gaps. It is so important for our community to know that these issues are there and that there are solutions and ways that they can contribute to improving the cause. So with that, we would like to thank you so much for participating and listening to our webinar today. This is our contact information. So if you need anything specific, or if you have additional questions, how you'd like to get engaged with this information, we would encourage you to reach out to us. You can also go to that unitedforalice.org website in order to take a look at the data yourself and see what additional information that you can find. As far as next steps go, we would like to invite you, as Amanda had said, towards the end of summer, as we will receive our disabilities data, the specific focus on disabilities. And we are planning to do another community-wide information session to share the results that we find from that. And then following the release of that report in November, we'll have a focused report on veterans. And so we're hoping to share that information before the end of the year as well, so that you all will have access to something that is much more focused as we're looking at ALICE families. Amanda, is there anything else that you'd like to add?
No, I think you've covered it.
Okay. Well, again, thank you so much. And if you guys need anything else from us in order to talk more about the data, please reach out. Thanks.